Thank you so much. Now, for anyone who's joining us or anyone who's joined a bit later, we just had our first speaker. Our topic for today is trends and the practices in occupational safety and health promotion. And we just had the director of the directorate of sorry, the director of DOSH. And next up, we have Dr. Wafiyya, who's a clinical psychologist at Aga Khan, and she's going to be talking to us about depression in the workspace in this case. So we have a short video from her, I believe, and then we can continue from there. Welcome, Dr. Wafiyya. Thank you.
I was an outgoing person, so to speak, but all that was stripped away, all thanks to the pandemic. At some point, I just felt like, look, what's the usefulness or what's the essence of living? After much thought and delay, I decided to seek the help of a professional. That was when I was diagnosed with clinical depression. It was when I was able to get across to a professional that I could give a name to what was wrong. I was able to share with family members, and then everyone tried their possible best to be there for me. Everyone can only do as much as they can. At the end of the day, you still have to develop some coping mechanisms for yourself. So music, exercise, taking a walk helped me to cope with this period of my life. Whenever I have the opportunity to speak with people who are going through similar experience, I try to share my story, but to let them understand that we're all human and it could happen to anybody. What I would love to see is where is a community, a place where we treat mental health the same way we treat every other form of health, and not make it seem like it's a taboo. Just knowing that you have people that you can talk to when the chips are down goes a long way. So I'm where I am today because I sought help.
Wafiyya, you can share your presentation.
Okay, please give me 1 minute.
Share a window, not your screen. Share a window, that will be fine.
Yeah, okay. Are you able to see my screen? Can you see my screen?
Yes, we can. Try and put it into presentation mode though.
So good morning, everybody. Thank you for having me here. First, let me clarify that I am not a doctor yet. I am a clinical psychologist and a doctor in the making, but I'm not there yet. Thank you. So today,
Okay, thank you for that clarification. Thank you.
So today I will be talking about depression, and then I will touch on how, especially with the pandemic, and how it has affected people and at the workplace. Okay, so life presents us with all sorts of challenges, be it death, illness, loss of a job, divorce, disgrace. We saw with the pandemic, social isolation. There is nothing like a perfect life. Everybody who posts on Instagram and or any social media presenting a perfect, happy life, that is never the reality. Even though we tend to look at it and think so, but that is never the reality. There is nothing like a perfect life. Life comes with its fair share of challenges. Now, it doesn't mean that these challenges will always lead to depression, but it does for some people. Sometimes it leads to sadness or grief. Sadness or grief are not the same as depression, and I will go a bit more into detail later on, but just briefly for now, sadness or grief tend to lessen in intensity as time goes by. So depression, however, does not lessen in intensity as time passes. And in fact, it also involves feelings of low self-esteem and feelings of deep guilt. With sadness and grief, you do not have low self-esteem or feelings of deep guilt, but this comes with depression. So depression is a serious
Right.
but treatable. Yeah, it's okay. Depression is a serious but it's a treatable mental disorder, and it's characterized by profound sadness and an inability to experience pleasure. So let us look a bit into what happens in the brain with somebody who is facing depression. There's an area of the brain known as the hippocampus. You can see it in the image there. It's highlighted in purple, hippocampus, and it's the memory center of the brain. Now, there was a study that showed that 65% of depressed people had a smaller hippocampus. The hippocampus had shrinked, thereby meaning that this memory center is affected. And this is one thing you tend to see with people who have depression, who've had depression for a while. They tell you, I'm having trouble with my memory. I can't remember things. I can't retain new information. And this is the reason why, because the hippocampus is affected. However, this does not apply to those ones who are having the first episode of depression. It's normally when it has happened for a while. The more episodes of depression, the greater the shrinkage of the hippocampus. Then there is another part of the brain known as the amygdala, which if you go back to the previous slide, you will see where the amygdala is. Yeah, if you see where the amygdala is, it's the one in green, and this is the part of the brain that deals with emotions, responsible for emotions. Okay, so I hope you can see that. So this part of the brain is responsible for emotion as well as memory, together with the hippocampus, and the fight or the flight response. You know, when you see something that scares you, something that frightens you, your body immediately responds. You either want to fight back or you want to run away. This is the part of your brain that is responsible for that. So during depression, this part becomes enlarged. Therefore, it makes it more active. And because of that, it makes it difficult to control emotions. That is why you might find somebody who is just they always seem angry, they always seem irritable, they always seem sad. So if you have a colleague who you find has changed, they used to be jolly and happy, but now you suddenly see them, most of the time they're irritable, or there's a particular time of the day they just seem to be irritable, they're sad. Maybe sit down and find out more. It could be, it is a result, they might be going through depression and you might not even know about it. Something else that happens in the brain is brain inflammation. People with depression have more inflammation in the brain. There was a study that found people who had struggled with depression for more than 10 years had 30% more inflammation in their brain. This is a big one, okay? And then we have neurotransmitters. Now, neurotransmitters are the chemical messengers in our brain. This is how the information is transferred in different parts of your brain. So we have the neurotransmitter known as dopamine. Dopamine is responsible for positive feelings of reward and reinforcement. And anytime you do something that feel good, you feel happy about it and you want to do it again, it's because you have produced dopamine. So some evidence has shown that with depression, there is some reduced dopamine levels in the brain, okay? Then there is norepinephrine. This is associated with the fight or flight response, which I just spoke about. Some studies have shown that depression occurs when there is less of this in some brain circuits. When there is less, then there is depression. But then when there is too much, you might have heard of something called mania. Mania which especially comes in bipolar disorder. You've got depression and mania. When somebody is, we can say, extremely hyper. So when there's too much norepinephrine, it's mania. When there's too little, it's associated with depression. Finally, the last neurotransmitter is serotonin, which is also a feel-good chemical. It helps to regulate mood. So low levels of this neurotransmitter have also been associated with depressed mood and anxiety. A lot of times, depression and anxiety tend to present together, and I will also talk a bit more about that later on. So before moving on, what are the symptoms that somebody has depression? What do you look out for? Sometimes it is difficult for somebody to know on their own that they have depression. Sometimes it takes somebody around them, a colleague or a family or a friend, to see that somebody has changed. They notice, and then they are the ones who would refer them maybe to seek help. So what are the symptoms of depression? Feelings empty, somebody being sad or irritable most of the day. you see that somebody has lost interest in their work. They used to be very motivated, but suddenly they seem to have lost interest. And not only in their work, even maybe there is after work activities, you see that they're no longer interested. They're no longer interested in socializing with colleagues. Then there is significant weight loss or weight gain, and a decrease or an increase in appetite without dieting, without an deliberate effort of dieting, okay? And then there's insomnia, which is the inability to sleep, or hypersomnia, which is too much sleeping. There's loss of energy. You find that somebody suddenly they're just tired. They're being sent to do something. They're being asked to do a project. They're not completing projects. They just seem to have lost. They have no energy. Feeling worthless. Before, when I started, I mentioned the low self-esteem, which comes with depression. So this is it. Somebody feels like they have no worth in this life. Very low self-esteem. Reduced ability to think or concentrate. They just can't focus. In a meeting, they can't seem to focus. Trying to do a project, they can't seem to focus. And then there's suicidal thoughts. So sometimes depression can, when it doesn't get treatment in time, because depression is on a continuum. You've got mild, moderate, and severe. So if you don't get treatment and it keeps becoming severe, it can lead to suicidal thoughts, and sometimes somebody actually goes ahead and attempts suicide. Next, there's another point. And then there's unexplained head or body ache. So you've got somebody who talks about a headache, a stomach ache, but every time they go for any checkups, everything is clear. Nothing seems to be the issue. Sometimes once all tests come out clear, then we now look at it from a psychological point of view, that it might be as a result of too much stress, or it might be as a result of depression. And I'll explain the difference between stress and depression shortly. So there are many different kinds of depressive disorders. A lot of times we just tend to say clinical depression or depression, but that's not the only type of depression we have. Clinical depression is also what we call major depressive disorder. This is the most common one, but it's not the only one. And for somebody to be diagnosed with a major depressive disorder or clinical depression, they need to have had the symptoms continuously for at least 2 weeks. And then we have persistent depressive disorder or dysthymia. For somebody to be diagnosed with this, they need to have at least 2 years of symptoms. And in those 2 years, they should not have more than 2 months where they don't have any symptoms. So 2 years for adults and 1 year for children and adolescents. And then we have disruptive mood dysregulation disorder. This is for children, for people between 6 to 18 years. You have them having severe recurrent temper outbursts. Now, it's important to note that symptoms of depression will come in differently for adults and for children. So it's also good to know, because even for the workplace, yes, it's only adults, but you do have children. So to also be able to realize this is what is happening to my child. Because sometimes you have that because of what is happening to the child at home, it affects a parent, and as a result, it affects them at the workplace. It affects their productivity at work. So sometimes children can have this disruptive mood dysregulation disorder. And then for women, you have premenstrual dysphoric disorder, which is extreme mood changes, irritability, and anxiety symptoms that happen only during menses, not any other time. And then you've got a depressive disorder due to another medical condition. So sometimes you can have somebody who presents with depression, but it doesn't seem to rise. They are on medication, they are going through therapy, but it just seems not to rise. Sometimes there could be a medical issue behind it. We send them to check for hypothyroidism, because hypothyroidism is associated with depression. Then there's brain tumors and dialysis. For some reason, people who go through dialysis, after a while, they tend to present with symptoms of depression. I'm not sure why that happens, but I've seen quite a bit of that. And then finally, we have postpartum depression, which is a major form of depression, which is very frequent, but it's not spoken about because of shaming of mothers. And this is because of hormonal changes and sudden change in lifestyle. It happens to new mothers, but it can even happen if somebody is on their second or third childbirth. It doesn't only have to be the first child. So this is very common, but it's not something that is spoken about very frequently. It's something that is hidden, which is not very good. So statistics, now there has been an increase in levels of depression after the pandemic. However, I could not find statistics that clearly confirm, especially the only ones they're just numbers being mentioned, maybe for the US or something, but I couldn't find globally, or maybe particularly in Kenya, or particularly in which country. However, it is noted that there has been an increase after the pandemic set in. So the World Health Organization, in a report that they had released, this is before the pandemic, they spoke about that globally, total number of people with depression is estimated to exceed 300 million. And it is considered to be the leading cause of disability globally, okay? It's a major contributor to suicide deaths per year. There are estimates of more than 800,000 cases of suicide every year. The presentation seems to have disappeared. Okay. It is the fourth leading cause of death in 15 to 29-year-olds. And there are more women tend to be affected by depression than men. However, more men die by suicide than women. And why this is, it is mostly related to women talk between each other. And I think also there is that notion that it's okay for a woman to express her feelings. It's okay for them to talk about. And women have groups, they talk about these things. But men are not allowed, because they're supposed to appear to be strong or tough. And if they talk, then it's not, it's a form of weakness, which is not true. But because of that, men don't seek out help. And when men attempt suicide, they go for more lethal methods of suicide than women. So more lethal methods include, things like hanging, or it's just a method that there is no turning back. Other methods are less lethal, and those are the ones that women tend to use. For Kenya particularly, there are this was in 2015, 1.9 million cases of depression. However, I don't think this is the actual one, because a lot of people with depression it's not caught, they don't speak out. So I don't think this number is an actual representative, and this is in 2015. I have seen, from what I've seen, the numbers have gone much, much higher since the pandemic. So what are the risk factors and the causes of this depression? Genetics is a major factor. If you find that in a family, sometimes you get that a parent had it, quite a number of, maybe you have like 2 or 3 siblings have it. You check the mother's siblings, or the maternal side or the paternal side, you have a history of depression, then there is a higher risk factor that somebody might get this as well. And then there's stressful or traumatic life events. With the pandemic, one thing that I came to realize in the cases that I was seeing, a lot of people were affected because so many people lost loved ones. So you have somebody who lost maybe 2 people in 1 week, and then another 2 people the next week. In a very short period, people lost so many. And grief and depression can appear to have the same symptoms, although they are not, but sometimes they appear to have the same. And if grief is not treated, it can turn to become depression. And then there's chronic physical illness. There is workplace stress. Workplace stress can cause, if it is not looked into, it can turn to become depression. There is marital stress. There is unemployment. And then there are some personalities that are more susceptible to it, like the people who are melancholic. They can be, I'm not saying for sure that these people get depression, no, but they are more susceptible to it. And then there is poor parenting. There is with social isolation, with what happened, people who are living alone. You find that now, because everybody was working from home, they can't go out anymore. They were living on their own. This did bring about quite a bit of, it increased the cases of depression. Then there's delay in seeking the right medication, because sometimes maybe somebody is not aware what is happening to them, or sometimes they're aware but they don't know that help is available. And then there's substance use or side effects of medication, which can also be a risk factor to depression. So COVID-19 and depression, there were multiple losses, as I had mentioned, especially with death, loss of loved ones, but also loss of jobs. There was salary reductions. There was a lot of pressure, and all these did increase the rates of depression. And I saw a lot of panic attacks, anxiety, and depression. Now, sometimes somebody can have panic attacks and it looks like it's anxiety, but if you assess, you find there is a history of grief, and And these panic attacks are not actually because of the panic attacks are anxiety, but the main cause is because of the depression and the losses that they faced. And then I did also see that a lot of adolescents were presenting with symptoms of severe depression, and the parents had no idea. The parents would only come and say, my child is refusing. I go to work, I come back, my child is refusing to do. They have homework, they have assignments, they're not doing it, they're withdrawing, they're no longer sitting with the family. I don't understand. But when you talk that the child is severely depressed and they're talking about they're hiding knives or they've hidden methods of suicide, and the parents have no idea. So because of this whole staying at home, witnessing parental conflicts, there was an increase in domestic violence, for children being exposed to that, for children being able to go to school or being able to go for gym or PE. That was a coping skill for them, and now they no longer had this. So this became, it increased, and as a result, the parents were also getting very stressed, and it was affecting them. So I think it's important to distinguish between stress, depression, and grief, because these can present with similar symptoms. Now, stress involves having too much to do. You have so many assignments, you have so many projects, but there is the hope that once I have everything under control, I'll be okay. That hope is not there in depression. In depression, there is persistent sad mood and an inability to experience pleasure. With stress, when you're in that environment that causes you stress, you are not okay, you're very down, you're irritable. But once you're out, once you're in another environment, you're completely okay. With depression, it is not so. Regardless of which environment you're in, that sad mood is persistent, okay, and you can't experience pleasure. And then the sadness is not tied to any specific memory or event. Yeah, then there's feelings of worthlessness and self-loathing, which are not there in stress. And then there is thoughts of dying due to feelings of worthlessness and having too much pain. But when it comes to grief, those feelings of wanting to die is not because you feel worthless, but it's because you want to join the person. You feel like, I want to be with them, joining the loved one, because there's that grief happening. And then with grief, self-esteem is normally preserved and it decreases with time. And there might also be feelings of emptiness and loss, but this is not, it decreases as time goes on. Sometimes if grief is not, if it doesn't get better, if it's not looked, if somebody doesn't grieve properly, if there's something blocking that grieving, it tends to turn to become complicated grief, and complicated grief can result in depression, because it doesn't get better with time, and the more this is not looked into, the symptoms keep getting more severe, until now you have somebody with severe depression and suicidal thoughts. And so there are some illnesses that can coexist with or present as depression. Anxiety tends to depression and anxiety tend to come together a lot of the times. Eating disorders can present, they can appear to be depression, or they can coexist with depression. You have post-traumatic stress disorder, when somebody has gone through some kind of trauma, whether in their recent past or even in their childhood. It can appear to be depression because of that traumatic history. Then there's borderline personality disorder. A lot of times I found that this particular personality disorder can present, it's very easy to think that this is depression, but in actual sense it's a personality disorder, because it has similar symptoms to depression: feelings of emptiness, very low feelings of worthlessness, unstable self-image. They have similar things. But when you try to, if you see somebody and you try to treat them for depression and you see that this is not rising, then we assess for other things. Now that's when we now start to assess, could this be a personality disorder and not just depression? And then you've got substance use disorders, because sometimes when people are going through major stresses or grief, they use substances as a coping skill. And that is also one symptom for adults. Remember, I said that depression can present in different ways for different age groups. So for adults, sometimes you find that they are suddenly so much into drinking after work. You see that they head straight, at work, they look like they've just been. It might be they're trying to cope with several stresses, and that is why they're getting into this. And then adjustment disorder has to do with major life changes, and somebody is having difficulty adapting to that change. So this can also present with similar symptoms, but it is not depression. It's also treatable. Okay. And then you've got medical conditions, hypothyroid, like I had mentioned. Even vitamin D deficiency can appear to have symptoms that are similar to depression. You have somebody with vitamin D deficiency, sometimes you have them having suicidal thoughts, feeling low. But once they have maybe supplements or they're able to get that vitamin D, you find that it rises, it goes away on its own. Move forward, please. And chronic illnesses, things like cancer or even cardiovascular diseases, they also do tend to coexist or cause depression, bring about depression. So what is the treatment for depression? This depends on the severity of the condition. If it is severe, then medication might be necessary. This is the time that a clinical psychologist or any psychologist will refer you to a psychiatrist for further consultation because you need to be on medication. Psychotherapy or counseling has been shown to greatly improve or to greatly help with depression. We assess severity by using assessment tools. There are particular assessment tools that can tell us how severe this depression is. And then also dietary and lifestyle changes. You saw in the video that was first played, he talked about exercise helping him. Exercise has been shown to be a natural antidepressant, so releasing of endorphins, which produces a good feeling in the body. Limiting caffeine intake can also help with reducing feelings of anxiety. Remember, we said that anxiety and depression can co-occur, so this can help with that. So support, family support also, or friend support goes a long way, or work support also goes a long way. Just knowing that my supervisor or my employer or my manager saw me, cares about me. I've had people who come in and they say, I had given up, but because my supervisor reached out to me and found out to see if I'm okay, that really meant a lot. I knew that somebody cares and that they referred me to come and see you. So that support goes a very, very long way. That brings me to the end of my presentation. Thank you very much for listening. If there are any questions, I request to take just a few before I leave.
Any questions to Wafiyya, please? You can write in the chat or you can raise your hand. Or if you get some other questions after she has left, because she has other commitments she has to attend to this morning. So if you get some other questions during the day and you wish Ms. Hamid to answer them, you can write them in the chat and we'll make sure that she answers them and share the answers. Is that okay with you, Wafiyya?
Yes, it is. Very okay.
Thank you very much.
Can you hear me? Hello?
Harriet? Yeah?
Yes.
Please, go ahead.
I have a question to Dr. Wafiyya. Is it possible for someone to manifest all these types of depressive disorders? As in, you have the persistent depressive disorder, or leave that alone, postpartum depression, and maybe disruptive mood regulation. Is it possible?
Okay, so because these are all depression and the symptoms are very similar, you'd need because you might think that you have all of them, but when a professional can see you, they would be able to know which depression you have. Yeah, because you see, go ahead. You were saying something.
I'm asking because you might have, let's say, like the postpartum depression, but before you even got the baby, you had a condition before. Is it like you were never, the last time you were never cured, you are not well enough, and then also this sets in?
Yes, that is possible. So that would mean that you actually have depression, and the giving birth maybe just increased it or made it more severe. That means that somebody already has depression.
Okay.
Yeah.
Can this take so long, like let's say from 2018 coming to 2021? Is the period viable?
Yes, so yeah, so if you remember when I showed the presentation, is
Yes.
one of them dysthymia is when somebody has had symptoms of depression for more than 2 years. So at that point, you see even how we differentiate the different types of depression depends on the time. If you've had it for maybe 1 month, we would say it's now major depressive disorder. But if the same symptoms have gone on for more than 2 years for an adult, now that automatically becomes dysthymia.
Okay.
Yeah.
How comes maybe if you're seeking for help and then you are not even told, because during that video I saw the guy already knew that he had clinical depression, and when you're seeing someone, they don't specify which type of depression you have. Or could it be that it might be difficult considering that maybe there are two? Or rather, let me say this, maybe I might be having I might have had depression before, and maybe it was aggravated by now me getting a baby, because with babies they cry, you don't even have time for yourself.
Yeah. Yeah. Okay. So actually, in that video, that guy who said he was told by he visited a professional. That's when he was told that he has clinical depression. So what happens is, yes, you could be having, you already had depression. Now, why some people don't tell you the kind? The most common type of depression is the clinical depression, the major depressive disorder. So a lot of times when you go, that might be when you're told depression. A lot of times people mean that depression. Are you
Okay.
are you getting me? Yeah.
I'm getting you. Where are you based? Maybe I would like to come and see you.
I'm based at Aga Khan Hospital, Mombasa. Are you in Mombasa?
No, I'm not in Mombasa. I'm in Nairobi.
Okay, I am in Aga Khan Hospital, Mombasa. We do teleconsultation as well. How if you would like that, that's okay. But if not, I could also refer you to somebody in Nairobi. There are psychologists in Nairobi.
Okay.
Can I suggest, Harry, that we send you the contacts of Dr. Wafiyya, and you can get in touch
Yes.
with her, and she can assist you in the way possible, because we have to move on. If there are
Thank you.
no other questions, would like to go further. So we'll send you the contacts of Dr. Wafiyya, if that's okay with you, Dr. Wafiyya, so that you can get in touch.
Yeah, that's okay. It's fine.
Okay. Yeah, I don't see any other questions in the chat. Great presentation. We'll appreciate to get the slides. You don't mind that we share the slides, don't you? So we will share the slide as we always do. We'll let you know where you will access the slides.